And you can take it away, Dan.
Thank you. Good afternoon, everyone, and thank you for joining us today. For our friends from Austria, Guten Tag, willkommen. We greatly appreciate your support and your interest in contributing to the knowledge economy. My name is Dan Stringer, and I'm a member of the Board of Directors of Gateway Centre of Excellence in Rural Health. Gateway is located in Goderich, Ontario, Canada, and to our knowledge is the only rural health research centre in Canada governed by a volunteer board of directors. Partnered with several academic centres and healthcare facilities, Gateway aims to advance rural health teaching and research across Huron, Perth, Grey, and Bruce counties. Our mission is to improve the health and quality of life of rural residents through research, education, and communication. 2 years ago now, Gateway launched this virtual lecture series with social isolation being top of mind, and as the COVID-19 restrictions continued to heighten. There seemed no better time to launch this initiative. And through this lecture series, we hope to promote a culture of rural health knowledge and innovation while virtually connecting individuals and communities to help reduce social isolation. We give diplomas at the end of each semester to those with perfect attendance to recognize your commitment to and involvement with this education series. Today's speaker is Leslie Walker. Leslie is a Goderich native and a research associate at Gateway. The title of Leslie's presentation is Societal Implications of Artificial Intelligence and How Better Policies Can Help Reduce Inequality. In her role as a management consultant, Leslie was able to work on large digital transformation projects in the public sector in various countries across the globe. Through this work, she observed patterns in the types of clients she supported and the benefits they received. And this prompted her to attend higher education to better understand what can be done to reduce biases in public sector organizations. Leslie is currently completing her doctorate of social and economic sciences at the University of Technology in Vienna, Austria, and she joins us today from Vienna. Her research focuses on policies to reduce the inequality associated with artificial intelligence in healthcare. Leslie has a fondness for rural communities and has integrated this perspective into her research. And with Leslie today are an eclectic mix of panelists: Geneva Neal from Toronto, Stefan Salcher from Vienna, and Jay McFarlan from Huron County. Thank you, Leslie and panelists, for your time and insight today and for your time in the preparation discussions for the lecture. Before I pass this back to you, Leslie, so that you can introduce your panelists and begin the discussion, I want to mention something I heard recently, and that is connected to Mary Shelley's novel, Frankenstein. In that novel, Victor Frankenstein brings a monster, brings a dead body to life, and in effect creates a monster. And AI has been compared to Victor Frankenstein's monster, being unpredictable, dangerous, and uncontrollable. And I'm hoping you might, in your discussion today, comment on that comparison. I'll turn it over to you now, Leslie. Take it away.
I definitely will. And Dan, you can let me know if you ever see screws coming out of my neck, and then you can know that that's a bad sign that I've been taken over.
Okay.
Yeah, so my name is Leslie Walker. I'll introduce my panelists first, and then I'll talk a little bit more about my background and why we're all here today. So first, I would like to introduce Geneva Neal. She's a senior data analyst at Creative Destruction Lab with the University of Toronto. And they are a startup accelerator, which helps innovative and technical startups scale. We've got Stefan Salcher, who is here in Vienna. He's a serial entrepreneur coming from a computer science and media studies background. He's also the founder of the Young Entrepreneurs of Vienna. And then we have Jay McFarlan, Gateway's own Jay. Perhaps you guys have seen him on other panel discussions before. He's a research chair of rural nutrition and exercise on the board of directors and the resident technical expert if there are any technical issues with this program or any others or any printer that is not working, Jay is definitely the one that all of us turn to for that. So thank you all so much for being here. And I'm Leslie Walker. As Dan had mentioned, I'm originally from Goderich, Ontario. And so my love for all things rural really runs deep, even in Vienna. I've brought the camo to Vienna, and I've received some criticism over my fashion choices, but I feel like it's in my bones, so there's not much I can do about it. But so I originate from Goderich, Ontario, but I worked for many years as a management consultant with large companies, including PricewaterhouseCoopers. And I specialized in digital transformations, particularly in the public sector. And so with this, I was so fortunate to have a wonderful, fulfilling career traveling around the world, working on these digital transformation projects. With that, you definitely do see trends and patterns in terms of the types of clients you have, the interactions you have with them, their concerns, and also kind of who's being left out of this conversation. And so that really was what prompted me to pursue higher education here in Vienna. And I think apart from being a beautiful city, like it's a shame it's dark out now, so you can't see the wonderful view. But I would say AI policy in Vienna is really the forefront of it. Like the UN, for instance, is located here. And so you see a lot of international policy conversations really taking place in Vienna. So I'm very much excited for this discussion with this kind of global perspective with all the panelists. So with that, I will share my screen. Panelists, please let me know if you can't see it. But in general, we're going to be talking about the societal implications of artificial intelligence. You definitely do not need to be an expert on AI to get value from this session. And we welcome any questions, comments, or feedback throughout. And if there's anything you want to know specifically, please feel free to write it in the chat, and we'll hopefully get to it during the panel discussion. So when Gateway first approached me about doing this session, Gateway is a rural health organization. And so my original thought was that we'll talk about healthcare and where AI fits into global healthcare. The problem is we really want to think about where emerging technologies fit into the greater context. So I'm going to take one step back from that and talk about the current state of the world. We're going as macro level as we possibly can in order to understand where we are, so we can appreciate where we're going and also design that journey. So in general, what's been going on? I mean, over the past 100 years, in general, things have been getting better. Lifespans have increased substantially because of better healthcare, better hygiene, healthier lifestyles, diet, more medical care. Wealth and productivity has also been increasing. I mean, most notably, there have been changes, some shifts in wealth, most notably from west to east in the last couple of decades. But in general, global wealth and productivity has increased globally. Also, things like literacy rate. Of course, it's increased, since, let's say, 1820, right? In 1820, the literacy rate was like 12%, right? It was pretty low. Now the global literacy rate is 87%, so quite high. But when we look at the literacy rate, even as recent as 1960, the global literacy rate in 1960 was only 42%. So we're talking about massive global improvements in terms of quality of life indicators in the last 50, 60, 100 years. Even things like interest and happiness is also much more on the rise. Local governments, national governments, city planning committees, and also individuals are more appreciating that happiness has an inherent place in quality of life, and it's being integrated into life planning. So in general, these are all truly wonderful things. The problem is with this is it really has massive regional differences. So the elephant in the room is, although all of those metrics have been improving, inequality has also been massively increasing. So when we say things are getting better, although that's true, the reality is this is very much dependent on who you ask. The inequality, both wealth and health between developing and developed countries is getting larger, but also within developing countries is getting larger. So although life in general has increased for most people over the past couple of generations, the reality is for some people it's gotten much better, and some people it's gotten a little bit better. So now let's talk about the current state of global healthcare, knowing that global context in terms of the macro kind of movements and patterns of the world. So unfortunately, this inequality is also true related to healthcare. Probably one of the greatest or most impactful phenomenons related to global health is something called the 1090 gap, whereby only 10% of global health research is devoted to conditions that account for 90% of the global disease burden. And then most diseases prevalent in low-income regions are often neglected. So when we think about this, we think of, if you were to compare spending on, rich diseases such as baldness or, Viagra, things like that, they absolutely dwarf the spending on things such as, the spending for malaria medications and, potentially life-saving medications. And so unfortunately, this gap is true not just from a treatment perspective, but also from a diagnostic perspective and a preventative health perspective. So you've got wealth inequalities increasing, health inequalities continuing to increase. And then we've got this, this white elephant of emerging technologies, which offer extraordinary innovations, which are changing the space. However, they're disproportionately only occurring in wealthy countries as opposed to developing countries. And so they're just unfortunately out of reach for many developing countries. So when I'm talking about emerging technologies, I'm talking about, larger than AI. AI is simply one of them, but really there's about, let's say 10 of them, which are complementary and also completely changing the space. I'm talking about cloud technologies, the Internet of Things, automation, like robotic process automation, AI, sure, but really this a ton of emerging technologies which have changed a lot of industries and disrupted a ton of industries. So thus far, these emerging technologies have contributed many benefits, including outcomes such as reduced poverty, increased global health, improved food quality and distribution, increased public safety, with these potential benefits expected to grow rapidly. But the problem is, you're only seeing this in very specific contexts. So if we were to hone down specifically to AI, let's first consider what is AI? Because I think so often AI is used as a buzzword. It's used as a bit of a stamp to say we're innovative, we're on the cusp, we're a really cool company that's got on the pulse of everything that's happening. I would say most of the time it's, a basic bot or some sort of, process automation. It's not a robust AI. But when we talk about what AI actually is it's smart machines capable of performing tasks that typically require human intelligence. So with this, I'm talking playing chess. I'm talking driving a car, creating a report, perhaps, doing some accounting work, all that kind of stuff. And when we talk about AI, it's important that we make the distinction between the two different types to make sure that we're talking about the same thing. So the first one is artificial general intelligence. And so these are the semi-conscious bots that you see in movies that are trying to take over the world before Will Smith comes in and saves the day. That's not necessarily typical of what we see in markets today. The other type of artificial intelligence is artificial narrow intelligence, which is much more specific. It's a goal-oriented version of AI designed to better perform a single task. And so when we talk about, AI of today, what's in the market and what kind of AI are we seeing? It's almost exclusively artificial narrow intelligence. If you look at a self-driving car, for instance, it cannot call your neighbor. It can't argue with your neighbor about a fence. It cannot, make a date for you. It cannot interact with the world on a wider level than driving a car. And so pretty well, all markedly available AIs are artificial narrow intelligence. And so I think this distinction isn't made commonly enough. And so often when people think AI, they think, oh my God, like I'm going to have some robot human hybrid as a great grandchild, or like, what does this mean for me kind of thing. And that's just not the reality of it. So when we talk about examples of AI in healthcare, I want to talk about the different types. Now, this isn't the purpose of this presentation. So I just kind of word vomited all the examples of different types of AI in healthcare on the screen so that you can get an idea of how it fits into different healthcare processes. I do want to call out a few in particular, just to give you a sense of how it actually fits in. So let's just talk 3 at random. So in general, there are some things that humans are really good at and some things that humans aren't so great at. Same with an AI, some things that it's very good at and some things that it's not so great at. So humans are very good with things like empathy. We're very good with communication, especially nonverbal communication. But I mean, there are, as much as humans like to think, we're the king of the animal kingdom, we rule the world, we control the environment, we are imperfect. When we look at things like errors, like me personally, I've made a ton of mistakes today. If you were to ask my parents, I'm sure they would echo that it's been a series of mistakes, which has led me here kind of thing. And so humans need things like sleep, we need food, we make mistakes. We have only so long that we can have attention on things. Like if you've ever done a cross-country road trip across Canada, you know that it's so hard to focus for, days and days and hours on end. And then it's near impossible. And I think as humans, we need to have this humility to know, like, what are we good at and what aren't we good at? So when we look at errors in the healthcare system, I wanted us to reflect. So in terms of errors in the healthcare system, you can answer this in the chat or just in your head. How many errors in healthcare do you think are caused by human error? Is it 20%? Is it 50%? 80%? The reality is it's 90%. And which is understandable. Like a lot of healthcare workers these days, especially during the COVID-19 pandemic, are overworked, they're burnt out, they've got a lot going on, they're constantly multitasking. So humans are going to make mistakes. And so it's areas like reduction of dosage errors, which can be hugely impactful because an AI can be used as a bit of a sense check to make sure that humans aren't making unnecessary errors. And the thing is, it's one thing if I make a mistake in terms of my accounting, my taxes at the end of the year, or who I date, or who whatever. But usually nobody dies from that, or nobody is seriously injured throughout their whole life, or is disabled or whatnot. But the problem with healthcare is the impacts are so huge and impactful to the patient, right? It could potentially be fatal. And so having extra checks really is a way to enable the healthcare worker to give them a bit more peace of mind. As well, robot-assisted surgery. These AI systems have been enlisted to perform tasks that typically require precision, control, and flexibility beyond the capabilities of a human. And so where there has been robot-assisted surgery, studies have shown, so for instance, open heart surgery, studies have shown that the surgeries that used robots had less complications, patients reported less pain, and they also had faster recovery rates than the surgeries performed by physicians alone. And so often I think it comes up, are humans going to take are humans going to take our jobs? Funny. Are robots going to take our jobs? You know, I don't necessarily, I think it's a much more of a collaborative process than people think, as humans and robots tag team and share their strengths with each other. In terms of automated image diagnosis, AI systems are used to decipher images and conduct analysis on these images. The studies have shown that they had improved performance to doctors. And for instance, you know, a human can, you know, work from 9 to 5, or let's say 12 hours a day. But they also need sleep, they need food, they need social time and whatnot. An AI bot can work 24 hours a day, right? It doesn't need any of those additional things. And so being so efficient with healthcare processes really helps to address the shortage of radiologists and other healthcare professionals that a lot of countries, including Canada, I mean, even Austria, but also developing countries are facing. So when we look at the 5 kind of high-level benefits of AI in healthcare, we see reduced patient wait times, we see more efficient healthcare processes, improved accuracy of diagnosis, improved communication and coordination with the patient, which allows, you know, potentially more of a collaborative process where patients can, you know, choose their own adventure in terms of healthcare. I think it's really changing the nature of the interactions between the patient and the healthcare facility, and then also substantial cost savings, so that, you know, in places where it's a public health funding system, that could potentially mean either less taxes or reattributing these profits into places that, you know, have a higher ROI or improve the citizen experience more. So then, where does my research fit into all of this? So the greatest challenge facing societies and firms would be utilizing the benefits of availing AI technologies, which provide vast opportunities for both new products and services and immense productivity improvements, while avoiding the dangers and disadvantages in terms of increased unemployment and greater wealth inequalities. And so it's exactly here where I focused my research, because I focused on digital transformation in the public sector in my consulting work. I think you're more in tune with the outcomes to the end user. But in this case, the end user is a citizen, it's a patient. It's not just, you know, are you helping one company make more money over another company? This has real human impacts. So what I did is I did a multi-case study approach in order to look at, are these patterns consistent over many countries? What can be learned from early adoptions, which are primarily in developed wealthy countries? And how can we improve the speed to adoption and also the ethical considerations in low resource countries or regions, so that we're not seeing, you know, wealth and health gaps be further increased by technology gaps. So to do this, I looked at a relatively resource-rich context, which is Canada, a relatively resource-poor context, which is Cameroon, and a dichotomous example, which is South Africa. Now, this is based on a variety of factors, and of course, there's a ton of disparity within the countries. But if you look at, for instance, the inequality in South Africa, it is much larger than the inequality in Canada, for instance. Also, if you look at the average income, GDP, access to healthcare services in Cameroon, it is much less than Canada, even when you look at rural regions or less service regions. But of course, there are totally regional differences, but we want to get an idea for what are these macro trends and what can be improved. So I'm going to talk about some of the research outcomes that have been seen at this point. I've only highlighted the ones that are relevant to Gateway. So if I were to go into these specifically, we see that current systems and policies do not sufficiently foster local competition, such as startups and accelerators. Right now, a large number of the organizations providing digital health services, digital health consulting, and so on are large companies such as big tech. And like when I say big tech, I mean the Googles, the Microsofts of the world, the very large technical firms. The problem is these systems are created in these, wealthy contexts, and then they're kind of slapped into, resource poor contexts, and that doesn't always work well. And also, this means that you don't have that same local advocacy. I feel like I advocate for a bit of a rural health setting because I'm from Goderich and because I see how important this is. But if I wasn't from Goderich, I probably wouldn't have that same, pull towards greater efficiency in this area. And so you really want to have sufficient local competition to, one, advocate for these regions, but also two, reduce the gap of the power dynamic. With more competition, you are able to change industry standards on things such as data exploitation or data privacy, and so on. Insufficient levels of independent research and financing threaten goals for ethical and equitable projects. So a lot of the research thus far has been sponsored by large private sector organizations. And I mean, anyone in academia know that that's a bit of a red flag, a bit of alarm bells, that you're not going to get robust, accurate results if there is that conflict of interest. Well, the importance of greater cross-sectional collaboration cannot be understated. So I believe it's 87% of digital transformation projects fail to achieve the desired ROI for a variety of reasons. Partially it's adoption, partially it's team dynamics and having two homogeneous teams. Very many technical experts, but not necessarily any change management experts, operations experts, healthcare professionals, and also patients or citizens and users being involved in this process. Gwen Devereaux will love this one. Human resourcing issues present a major threat to successful projects in low resource locations. So a lot of developing countries, including Cameroon, is facing a crisis in human health, human resources. And that makes it very difficult to successfully implement long-term projects with significant impacts and outcomes that are sustainable. As well as you look at the difference in a place like Canada, the gaps between urban healthcare services and rural healthcare services, it is more difficult to attract doctors, other health or even tech professionals to smaller communities, which makes it very, very difficult to reduce pervasive gaps. As well, a patient-centered perspective is not sufficiently embedded throughout policy, governance, and healthcare processes. I think how patients interact with healthcare processes has been changing over the last couple of decades. I think potentially a few decades ago, the communication was very one way. Like you say, I have a pain, your doctor says, okay, this is what you should take. Whereas now it's, I would say, much more of a collaborative conversation in terms of what works for one patient won't necessarily work for another patient. Patients have different goals, and also patients are more well informed, right? As much criticism as there is of using, Google, a lot of patients, particularly with rare diseases, have a lot more access to information and access to data than they did previously. And so it's important that the conversation changes. And so with this, when we're creating AI systems, it's important that we're not just taking an AI, slapping it into a current process, but rather we're taking this opportunity to reimagine the whole process. I've had so many projects where, for instance, we would have a client and they would say, we have, judicial services. Okay, so we need parking. And so let's get some digital parking app, and then people can use the parking app and it'll be more efficient. And then after the project commenced, there was some feedback by, either the local recipients of these services, and they said, well, I have to take time off work. I have to drive down there. There's not sufficient parking. And, even though this is a minor process improvement, there's no reason why we couldn't do a remote session, and that would have been much more preferred. So investment in a different type of technology would have been preferred. And I think too often people look at AI as this sexy, thing that will solve all our problems, and it's so far from that. And so really focusing on the end user and the patient is truly critical in what we're trying to achieve. So as I said, this is quite a high level conversation. I have a number of sources with this. If anybody is interested in the specific sources or where any of this came from, I highly encourage you to reach out to me. But in general, I think this is a wonderful opportunity to have a discussion with the panel. They say that if you're the smartest in the room, you're in the wrong room. And I truly feel that that is the case with this panel discussion. So I will stop sharing my screen and we will hop onto the panel discussion. So panelists, if you can unmute yourself. I was wondering if you had any thoughts first on the presentation. I see there have been some questions come in, but in general, thoughts, things to add, things that you think I missed?
So from my end, what I found really interesting is, and what I found that you highlighted very well, is the need to look at AI beyond the technical capabilities, right? Because this is what a lot of the conversation often focuses about. What can the technology do, but not necessarily how does it fit into a society, how does it fit into regulation, etc. So I feel like that's where I think this research is building the foundation for really important discussions. So I hope that we can talk about that, maybe also a little bit how the technology and the society interact.
Yeah, I would agree with a lot of what Stefan said. I think it was a really good overview of some of the issues that are presented with AI. I think a lot of times it's misunderstood, and working with data, sometimes there's this misconception that AI or data on its own will lead you to a decision. And I think that that's one of the areas. It's a very useful, that's a very useful tool for presenting information, for being able to digest information, maybe prioritize things, but it doesn't have the same ability of human judgment, and it doesn't necessarily tell you what your value should be. So it can present you with options. It can tell you if you're achieving what you want to achieve, for example, by looking at what the metrics are, what the outcomes are, but it doesn't give you a sense of what is a good outcome, right? So in healthcare, this is very important, of course, because we have a general idea of what might be better health, but that's not necessarily universally agreed upon. And so you could have an AI that tells you, whether or not you have a certain diagnosis, but that doesn't tell you what your personal risk assessment might be, or it doesn't tell you how you want to equitably give out resources or funding to different sectors. So I think that AI and its capabilities are important to talk about, but talking about the values and the judgment is where the humans have to interact with it, and we as a society have to make certain decisions.
So if I could just add to that, and Leslie, there was something I disagreed with in your presentation there. Maybe you can enlighten me. So I came to this conversation with the idea of how can artificial intelligence improve or make worse healthcare? You know, the health lens. And you mentioned the inequalities that exist between different nations. And I do think that in the case of artificial intelligence in healthcare, I think that the developed nations might have some problems because there's some private health information that and regulations that are going to restrict the use of AI. Whereas in the developing world, they don't have those regulations. And I think they may see greater benefits of the technology because there's a lack of regulation. But maybe, I mean, as a question for you and the audience, maybe you can help enlighten me of why that might not be the case.
Exactly. And I think one of the comments in the chat kind of alluded to this. I think it's a bit of a sliding scale in terms of opportunities versus risk. And the reality is in some developing, and pretty well in all countries, there's a different regulatory burden, and there's also a different quality of regulatory burden. Like some, I would say governments are more citizen focused than others. And so depending on who controls the data, who controls the legislation, that makes a significant difference. And so what works in one country doesn't necessarily work in another. I think developing countries, which are open to the lessons learned from developed countries, are able to leapfrog in a way that is not otherwise possible. However, that only works if they have a sufficiently stable government, a sufficiently responsible, non-corrupt government, things like that. But without a variety of factors in place, that simply won't be the case. And so it's very highly dependent on the context of each country.
And I mean, one thing, Jay, that I would maybe add to your concern from a technical perspective is, right, and AI oftentimes, and I think this is where you're right, is only as good as the data that you feed into it, right? However, more data does not necessarily mean that an AI can work better. In the field, they say garbage in, garbage out. So especially when we look at healthcare data, right? And Leslie mentioned, for example, the example of an AI that is doing image diagnosis, right? You don't need to feed necessarily like your private emails into that to do a diagnosis, but what you need is a robust AI that does that job very well. And it is typically within, I would say, like within the task of creating that AI to collect the data set. And that's actually one of the hardest parts sometimes. And I don't think that regulation necessarily is a bad thing there. On the other hand, what you often see is that if you feed too much data into something, or you check too many things, you can get something that in the healthcare sector would call overdiagnosis, right? It's the reason why when you hurt, when you have a cut on your hand, you won't do a full body CT scan, right? And so you sometimes need the right data, and I think that should be attainable for even with regulation. Yeah.
I think what Jay mentioned though is interesting, because I could see both sides of this. So a lot of the companies that come through our program have that same issue of, okay, should we try for like FDA or Health Canada or the European equivalent certification, so we're used for insured services and things like that, or should we just try to open on the market? You see this a lot with I don't know, say mental health apps currently, things that might be open to the public. But I could see this happening. So I could see this happening with other types of apps. So in the Canadian or American context, for example, often the regulatory burden is so high that, like Jay mentioned, we're not necessarily seeing the benefit that we could. So I think there needs to be a balance struck. On the other hand, so I think there's a lot of opportunities in developing nations where there are fewer regulations. On the other hand, it depends on who gets in there and who gets there first. Like I can sort of see a situation where maybe there's greater access to, for example, an app where you put in, you know, we've all done this before, you like Google your symptoms, but let's say that it was much better, that it had the same a lot of the same knowledge and capabilities as a general practitioner, like as a family doctor, and you could get relatively good diagnoses. I could see that being of great benefit in a developing nation. The issue is just ensuring if you don't have any regulatory framework and you're dealing with populations that are maybe more vulnerable due to lack of education or lower socioeconomic status, you could have sort of nefarious like private entities that are trying to sell certain cures or have other incentives for maybe creating fear in the population, et cetera. So I think you have to be a bit careful if there's not the right market pressures to make sure that the apps are actually promoting health in the way that we would all like them to, or like any other AI service. I think that's one potential concern. So I think finding the right balance in terms of making sure that there's regulation, but not such a high regulatory burden that the technology becomes inaccessible, I think is going to be a major like public conversation that we're going to have to grapple with.
Exactly. And Geneva, like to your point, like many experts are saying, like that the next phase of exploitation in Africa is data exploitation. And so like these are very real, like systemic concerns. But then, yeah, then on the other hand, you have people who otherwise wouldn't have access to healthcare services. And so, you know, it's really not an easy decision. And I think this is why it's so difficult for legislators or local governments in those areas, because they've got to make really difficult decisions, which most of the time in high resource context, we don't have to make those same, you know, do or die decisions because of that regulatory burden. But it takes many decades to be able to improve that and hone that. So getting back to kind of the Goderich, Huron County rural context, I was just wondering, so how can existing organizations, or even just looking in the Canada context, or the Austria context for you, Stefan, I won't leave you out of this, but how can existing organizations utilize AI? Because this is a much larger conversation than just healthcare. So Stefan, do you want to go first?
Yeah, definitely. So, I mean, I think AI recently has been in the news all over the place, right? Whereas startups for the past years have incorporated, and I'm talking about startups because that's kind of the ecosystem that I'm most in. And startups have incorporated AI in many different areas of what they do, right? And one thing that I found very interesting about your presentation is also that you and one thing that in the startup scene but all over comes up a lot is this question is is AI going to take our jobs? And I found it interesting that actually we kind of see the opposite, that we often see AI projects fail because there is not enough human resource there to make the processes work. And I think that's also what we see right now in the startup ecosystem. We see that actually we need more people to work with these systems to increase or do things better, to increase productivity, efficiency. And so if you're asking, okay, how are we using AI right now? Well, we're using it in many different areas, in marketing, in sales, in improving any kind of process where we can supplement human intelligence with these processes. But the biggest challenge often right now is that we can't do enough of it because there are not enough experts, people to interact with the AI and actually use it. So that's kind of my perspective from the startup scene on that.
Okay, I'd love to go next in this one. I think how can existing organizations use AI? And I think we can use AI right now as it currently exists in these very I don't want to say primitive tools, but this first generation of easily accessible tools. There's just this last Friday, as part of Microsoft Teams Business Premium, you can now have a meeting summary automatically generated after you've concluded your video chat, your video meeting. And you know, that's fantastic, especially for someone who's supposed to be taking minutes of the meeting and distributing that to anyone who wasn't present. The example of this particular recording right here, for some people, they may have the captions enabled. I mean, after this meeting, we have a part-time staff member at Gateway whose job it is to create a press release based on the conversation here. Well, Carissa, you can use the transcript, put that in ChatGPT and say, write me a press release based on this webinar. And it does an okay job. It does, like, there's still some finesse. It's just a language model that helps you with a bare bones starting position. But it's already a very powerful tool for making people's roles more productive, being able to accomplish more in a shorter period of time, and not having to rely on bringing others into the team to have your small nonprofit or small organization be able to do more. I think it's a great tool for helping people accomplish what they want to accomplish.
Yeah, I agree with what both Stefan and Jay have said, that I think that there's a lot of opportunities for many businesses to automate or replace certain mundane, repetitive tasks that most people don't necessarily find fulfilling. They're very time consuming, and sometimes they're a distraction from doing the core work of an organization. I think that a lot of organizations, though, they aren't necessarily at the place where they can fully take advantage of AI. So like Jay said, if you're already using a tool like Teams or Slack or Zoom, there's going to be certain built-in features, or you might be able to use a chatbot for your customer service. So those kind of point solutions with a ready-made AI, you can often just drop into your existing business. But I think there's still a lot of legwork that needs to be done to fully take advantage. Like Stefan was saying, often you need a certain technological baseline. You need to have enough data about your consumers or your patients, et cetera, to make the use of AI worthwhile. So I think there's a lot of opportunities to use AI with like the startup products that are out there, or the larger existing products. But I think there's still a lot of kind of base work and infrastructure that needs to go into to allow us to fully take advantage of these technologies.
I mean, I completely agree. Like, so much of the digital adoption work that I did before, it's like we would be moving a company to, maybe from Microsoft Office Suite to Office 365 or G Suite. So moving it, from a desktop version to the cloud. And it was a very difficult process. It required a ton of change management, training and whatnot. And like, that's not even talking about this whole AI sphere. And so I think change takes time. And so that's very important. And kind of, Stefan, to your point before, in terms of losing jobs or gaining jobs, someone asked me before, should I be worried? Like, am I going to lose my job to AI, or is AI a big threat? And I essentially said, well, it depends what kind of job you want. There are some folks who want to be active learners throughout their career and learn new things and adapt and try different things. And there are some folks who say, I want to be X, my dad was X, my grandpa was X, and I just want to do that. And, that's all I want to be. And I said, that's good. It's interesting, because depending on the job, that might be a tough go over the net. If you're younger and you still have decades left in your career, there's a good chance that, for instance, like truck driving or whatnot, will be disrupted by different technological systems. So I think mindset also makes such a big difference with this, in terms of what are your expectations with your career. And I think with small towns, it's interesting because often small towns, can be more traditional in nature, or conservative in terms of innovation and whatnot. And so I think it's really interesting and I would love to hear all of your thoughts on how can we set small towns up, or rural communities, or even, Stefan, I think we can both agree that Austria is also a very traditional society. How can we set up these regions for success in terms of digital disruption and digital revolutions?
I think that's a really good point. What I think the interesting thing here is, when people think about their jobs changing, they usually think about them getting harder, getting more complicated, right? However, what the job of AI should be, and is, if it is done well, is actually to make the jobs more human. Why? because an AI, if it is done well, actually doesn't feel like something technological. It actually feels like something that is better suited to me, right? Like we've seen, for example, with a good chatbot, it should feel like talking to a real person, right? And the better AI gets, actually, the hopefully more human we can be, again, in interacting with our technology, right? Right now, we need to know a lot of technical knowledge to accomplish something, right? To even to write an email, you need to know how to set up your email program, how to sign up. If you could just tell your computer, hey, can you write a message to this and that person? Actually, it might change the interaction to make it more accessible. And that is also, I think, where all of the points that you mentioned in your presentation come in. We have to put the patient or the user in the center of the interaction and not develop AI systems that make it more complicated. Quite the opposite. We need to make them more simple and more human for us to use.
I think building off of Stefan, I think it will make things more human, but I also think that what you said about small communities and kind of innovation is that I think we need to be thinking about, okay, if let's say that you have a relatively repetitive task, or maybe you're doing something manually, like inputting data or something like that, that might in the foreseeable future be replaced. If that's taking up, I don't know, 80% of your working hours, I think businesses and leaders need to be thinking about, okay, if I were able to free up that much human time and effort, what would I be able to do with it next? So I think that knowing kind of what direction we could move in and thinking about what the possibilities are, what are the more human, the tasks that require, human relationship building or human judgment, that we could be taking advantage of the resources that we have and the employees that we have. What could we be doing that's more than what we're currently doing? So I think it's true that if you just think about, could my job be replaced? Some jobs will definitely be replaced, but it's about thinking about what's coming next. And if we were to free up all of that time, what can we do? What can we build on, instead of just saying, okay, now you've been replaced with an AI and then completely getting rid of that potential.
Yeah, I agree, Geneva. I don't think AI is going to be replacing us. It's going to be enhancing us and bringing us to our full potential. I saw a question in the Q&A about making the gap in socioeconomic status even greater than it already is. I think AI can be used as a fantastic tool for teaching, education, and helping to uplift people out of a low socioeconomic status situation. There's so many reasons for why people might end up in a low socioeconomic status situation in their life, and I think learning is a huge part of it, and their ability to succeed in a traditional school, and having a customized artificial intelligence guided classroom, or a teacher that's guided by AI to help each student recognize their shortfalls. It has a huge potential in helping to bring some of those people up the SES ladder. Of course, it can be like any tool of the past, whether it's the printing press or the internet itself. There are downfalls, there are downsides, and it's not all roses. It can be used for nefarious things. So I think we do have to be careful, but on the whole, I think it has more advantages, more good things, and we don't need to be scared of it.
Exactly, and I think I can feel the impending Dan gonna come on to tell us that we're approaching the hour, and so I think I'll just do a quick wrap up and closing, because I think the long and short of it is it has tremendous potential and it can be a really good thing. But also if there's unequal access or skewed data ownership or poor data quality, any of this, it can also be very bad and make things worse. And so really so much of it is in how we implement it and not just what do we implement. And that is not an easy question. And that requires a tremendous amount of manpower, of human power to sort out these problems. And so I really think that this is a wonderfully interesting topic. It's been wonderful having this session with you guys. And feel free to let me know if you guys have any closing thoughts before Dan hops on and cuts us off.
Well, I just want to say if there are a lot of questions we did not get to in the chat, and so I'll send these off to Leslie and make sure that she can answer them or provide an answer for you after the session. But I'll shut up now.
Hi, Leslie, I'm back. But you don't have to stop talking. So I'll give you a couple more minutes of the stage or the podium, and then I'll do the wrap-up remarks.
Okay, so then we'll do one kind of rapid fire in terms of action-oriented. What can we do to attract and retain talent and develop these skill sets? And I'm talking, you know, a minute each kind of thing of short level answers. How do we get these folks in the places they need to be, whether they're in developing countries, whether they're in small towns, or whether we have, you know, more coordination between academic institutions, large healthcare corporations, and smaller communities, developing countries, and all that. So, Stefan, do you want to go first?
Ooh, I mean, it's a very hard question, right? Because that's what a lot of people are wondering all over the globe on how to do these things. I think from my perspective, from the startup scene, I think what we do need is, and you mentioned this, is funding that doesn't necessarily come from the traditional sources in startups that are typically venture capital, that are typically, you know, like maybe the big tech firms, but funding that comes from a public source, right? That comes towards research. Because I saw also one question in the chat deals with questions of ethics and AI in healthcare, right? And ethical questions are not typically on the forefront of a typical startup, right? And so to address these questions, we need influences from other sides. I think that's really important for the governments and regulators around the globe to recognize that we need money in that space that comes with the dedicated purpose of kind of steering the development into a, you know, maybe more objective direction.
Anyone else want to speak before I wrap this up?
Well, I'll just say that, you know, I think this has been a fantastic discussion, and thank you both, Stefan and Geneva, for your expert minds in this. And in terms of attracting and retaining talent, and my mindset goes to a rural healthcare setting. That's just where I am. One of the first points you brought up, Leslie, was happiness. That governments and people are very focused on what makes them happy, and outdoor green space is a fantastic happiness motivator. So I think living in a rural environment, I think that you're surrounded by outdoor green space, and I think that alone, from a rural healthcare perspective, is going to be a big driver for recruiting and retaining talent in our rural settings.
Just don't get Stefan or any other European going on about cars versus green space and all that kind of stuff. That'll be a different session for a different day.
I 100% agree with Jay. Living in downtown Toronto, I definitely miss the green space of Huron County. I think that the biggest thing though about talent and also trying to produce talent is making sure that our systems, and especially our education, is as flexible, and that we encourage openness to change, because ultimately I think the workplace is going to change significantly. Healthcare and how we interact with healthcare systems is going to change, and I think that can be a really positive thing, but we need to nurture a sort of more flexible and open mindset.
I agree. And just Dan, before you hop on, I want to thank everyone for joining this session. When this session was 20,000 miles high. It was very high level, and of course, the more you dig down into it, the more nuances you get. So you get to get a greater sense for risk assessment, potential impact assessments, things like that. But as an introductory session, I think this was a productive way to kind of set the stage. Potentially there will be a follow-up session to this. We'll get a sense for what the questions are, because I think a lot of them are legitimate. And so thank you very much, Dan, for inviting me. And honestly, thank you so much for you, Jay, Gwen, everyone, everything that Gateway does, because truly it's a wonderful resource to have in Goderich, and I'm very appreciative to be a part of it.
All right. Well, thank you, Leslie, for those kind words. And just before I do my final wrap up, I'll just comment that it has been a fascinating conversation on a fascinating topic. But bringing bright minds like yours and the panelists to focus on the developments in AI that are coming in the not too distant future is a good start. And your discussion today helps us understand what awaits in that not too distant future. The challenges and the changes coming for the workplace, for research, education, and the economy will be monumental and constant. And I wonder, will the human brain, will the human mind and human society, as Stefan has indicated, be able to keep pace and adapt? So we look forward to developments. So for everyone out there, today's lecture demonstrates what Gateway is all about. That is, bringing relevant health information and research data to our rural residents. Thank you, Leslie, for creating a conversation surrounding this topic, and to the panelists for all your insight. And yes, we'll book you for a second session, Leslie. This topic is too big to be squeezed into 1 hour. A huge thank you goes out to our sponsors for their continued support. Without them, the lecture series would not be possible. They include CIBC, Private Wealth Management, DeJager, Town Square IDA Pharmacy in Goderich, Zehrs, Goderich, the Town of Goderich, Libro Credit Union, and MacEwan and Feagan Insurance Brokers in Goderich. Gateway Center of Excellence in Rural Health is a not-for-profit organization with charitable status, and we greatly appreciate and welcome the support we receive. If you would like to donate to Gateway in support of this lecture series and other activities that Gateway undertakes, I encourage you to visit the Gateway website and click on the donate button. Gateway sells high-quality Gateway branded merchandise and clothing as one of its fundraising endeavors, and you can visit our online store through our website. With that, we could be providing you with unique Gateway merchandise to fit your gift giving and leisure wear requirements. Thank you to everyone out there for joining today's event. We look forward to seeing you at the next lecture series event at 12 noon on March 7th, 2023, when Dr. Scott Brown, Gateway Research Associate and brand new PhD graduate, will be our speaker. Scott got his PhD this past month after many years of hard work. Part of Scott's thesis work involved an in-depth study of Gateway and its development, and his talk is titled Gateway at the Intersection of Organization and Place. To learn more about Gateway, check out our new website. It's definitely worth a visit. And we hope you'll pass the lecture series information along to your networks. We hope to expand the reach of this lecture series with the aim of promoting the knowledge economy, reducing social isolation, and supporting Gateway's mission of improving the health and quality of life of rural residents. I did not mention in my thank yous that Huron is supporting us by broadcasting our lectures on their channel 1. We very much appreciate that. So we at Gateway wish all of you good rural health. We'll wish you happy Valentine's Day. See you next month. Thank you, and danke to our people who joined from Vienna and Austria. Bye for now.
Thank you, Dan. Auf Wiedersehen.